Here's my audience. Van Gogh, Mary Todd Lincoln, and Darrell Hammond were and are successful leaders in their respective fields. Though they all lived very different lives and at very different points in history, they all do have one thing in common. They were all diagnosed at some point in their lives as schizophrenic. As a psychology major, mental illness and spreading awareness of mental illnesses is very important to me, which is why I've chosen to discuss schizophrenia as today's informative speech topic. I'd like to talk a little bit about the symptoms of schizophrenia, relay a personal account of a patient with schizophrenia, as well as talk about how to identify symptoms of schizophrenia in yourself as well as in loved ones. Schizophrenia is defined as a brain disorder in which people interpret reality abnormally. It is a chronic, severe, and disabling brain disorder that affects about 1 in 100 people. Though many people assume that people with schizophrenia are violent and out of control, these misperceptions are not necessarily true and can be corrected with some education on mental illnesses. In men, schizophrenic symptoms typically begin in the early to mid-20s, while symptoms in females will usually begin in the late 20s. Symptoms involve a range of problems, including cognitive or thinking, behavioral, and emotional problems. There are 5 main symptoms, 4 of which are positive symptoms, which means that you have something that you don't want, and 1 negative symptom, which means that you don't have something that you do want. So the first positive symptom are delusions, which are false beliefs that are not based on reality. Some examples of this are believing that you're being harassed, that you have exceptional fame or ability, that another person is in love with you, or that someone is after you. The second positive symptom are hallucinations, seeing or hearing things that don't exist. Though we may not be able to see or hear them, the experience for people with schizophrenia is very real. The third is disorganized thinking, which is typically seen in speech. Communication may be impaired, answers to questions may be partially or completely unrelated, and often strings of words are put together in a completely unmeaningful way, which is often called word salad. The fourth positive symptom is disorganized or abnormal motor behavior. This can be exhibited in childlike or silly behavior or agitation. Posture may be inappropriate or strange, and there may be excessive or useless movement. Movement is typically not focused, which makes performing tasks very difficult. And finally, negative symptoms are the lack of ability to function normally, lacking emotion, the inability to make eye contact, a decreased range of facial expressions, or monotone speaking. Essentially, it's a lack of social responsiveness or engagement. Because it's easy to imagine a dramatized version of someone with schizophrenia, I'm going to briefly talk about an actual case of someone who has been affected by it. Professor Ellen Sachs is an advocate for schizophrenia and mental health awareness. She herself was diagnosed with the illness at the age of 21, though she experienced a psychotic episode at the age of 16. In her description, Sachs talks about standing up in the middle of her high school class and walking home, which is about 5 miles away. She talks about the houses down the street talking to her, trying to communicate with her, and they were telling her things such as walk, repent, you are special, and you are especially bad. In college, while attending Oxford, she really began experiencing symptoms in the form of depression, mild paranoia, and eventually mood disorder. Later on, while attending Yale Law School, she experienced a psychotic episode in which she found herself standing on the roof of the library singing in the middle of the night. This psychotic episode hospitalized her, and her hospitalization ended up in her diagnosis of schizophrenia. Even though she was diagnosed at the age of 21, it took her about 10 years to really come to terms with the fact that she was schizophrenic. However, since then, she has come to terms and learned to deal with her disorder. She talks about the importance of having auxiliary egos in her life, such as therapists, parents, and partners, who are able to recognize when her episodes are coming on and pull her out of her delusional state. She describes schizophrenia as a dimmer rather than a light switch, where one end of the dimmer might be a transient thought such as, I've killed 1,000 people, and the other end might be her sitting in a dark room shaking for a week. Though Sachs has dealt with these symptoms, she's learned to manage and cope with them in the form of medication and support groups. And through her struggles, she's managed to be very successful and as a professor, author, and TED Talk speaker. One important factor in managing schizophrenia is receiving treatment as early as possible, which she talks about. However, recognizing schizophrenia requires knowing how to identify the symptoms. There are many online psychosis indicator tests that can be taken. However, it's also important to know how to self-identify. Some of these symptoms may include having irrational suspicions, having an inability to express emotion or connect socially, being forgetful, and seeing or hearing things that the people around you are not experiencing. Other symptoms to look out for in your loved ones are social withdrawal, deterioration of personal hygiene, excessive or very little sleeping, odd or irrational statements, and extreme reaction to criticism. Thankfully, with the help of medication, these symptoms can be controlled and managed. Though schizophrenia is a mental illness that affects more people than we tend to believe, it's also an illness that, with proper treatment, can be managed such that patients can lead normal and productive lives. Schizophrenia does not discriminate and can affect anyone, even though we aren't really sure what the cause of schizophrenia is. If you believe that you or a loved one are experiencing schizophrenic symptoms, you can visit NIH's page on schizophrenia for more information, as well as communicate your symptoms to a doctor.